Hi, this is Dr. Frank Simoncini coming to you live from Southeast Valley Urology in Gilbert, Arizona. So today what we're going to talk about is the benefits of penile implant surgery. This is for erectile dysfunction, and that sounds drastic, but pills work for erectile dysfunction, which was a huge discovery, and it changed the course of medicine for erectile dysfunction for many years. In the books, the literature tells us about 65% of patients will respond to medical therapy, and that's probably fairly accurate. The problem comes when you're a patient that doesn't respond to medical therapy. There's 4 or 5 treatments available at that point, the problem being most of them don't work very well. So a penile implant is a mechanical device that goes in through a small opening between the penis and scrotum. It's permanent, you can't tell that it's there at all. There's a little pump down by the testicle. When you want an erection, you pump it up, it'll stay hard as long as you want, it'll give you an excellent erection, does not change the feeling whatsoever. You can have sex normally, orgasm normally, again, it's going to stay hard as long as you want. When you're finished, you push a button or press the release valve and it goes back down to normal. One of the best inventions I've ever seen. It's been around since the 1970s or 1980s. These have about a 92 to 96% patient satisfaction rate. They work very well. Most patients' comment is, I wish I did this a long time ago. Why is that? Well, the other treatments available don't really work very well. So one of those is a vacuum erection pump. A vacuum erection pump is a cylinder you place over the penis, you pump this up, and it supposedly draws blood into the penis, which it does, and there's a band that fits around the base of the penis that's supposed to keep it erect. Problem being, it doesn't work very well. If you look in the literature, it says it has about a 90% success rate. And that's one of the things I call in my practice that works well in the ivory towers of medicine in a textbook, but doesn't work in real life. The real success rate with a vacuum pump, to me, in my practice, seems like less than 5% of patients actually like them and use them, although a lot of people have tried them. There's also injection therapy. Injection therapy can work for some patients, but a lot of negatives to it. For one, you have to be able to stick a needle in your penis. 2, it has to work. 3, you have to be able to reproduce this successfully at home, which not everybody can do. 4, it hurts. 5, it can cause curvature of the penis over time. And most importantly, you can get an erection that lasts greater than 4 hours, which is very painful. You wind up in the emergency room. So nonetheless, it can work. The patients that actually go for that type of treatment and actually wind up using it, I think, is very low. So penile implant, does it sound radical? Well, it goes in through a small incision. It's an outpatient procedure. It's covered by Medicare. You can go home the same day. Usually within 3 to 4 weeks after the procedure, you're able to use this, and it's successful basically every time after that. Radical is a matter of opinion. Penile implant surgery is one of the greatest things for patients that do not respond to medical therapy for erectile dysfunction. Thank you.